Hi, everyone. Welcome to our webinar, the first of an author series being conducted by the Center for the Study of Human Health in the Emory College and supported by the Georgia Center for the Book. Just going to wait a moment and make sure we get all the tech lined up, especially my lighting levels on this very rainy afternoon here in Georgia. There's still a little light in the sky, unlike where our distinguished guest Deborah Mckenzie is. She is somewhere on the border of Switzerland, I think, and I am sure it is night there. I'm just double checking. Okay, we have enough participants to start. And we have a Zoom cat, it sounds like.
We have a Zoom cat. Yes,
That's
she
fantastic.
might zoom past. The only thing you're going to get on the camera is her tail, unfortunately.
Okay. All right. Well, I think we can get started. So hi, everybody. I am Maren McKenna. I'm a journalist and author, and I hold the position of Senior Fellow in the Center for the Study of Human Health at Emory. I'm the author of a couple of books, and it occurred to me as this pandemic kept unfolding that one of the things it was doing was taking away the traditional things that authors do to promote new books, which is to go out in the world and talk to people about them. And so we are going to try to fix that this fall. This is the first of a series of webinars with authors of new health and science books that we'll be conducting this fall, and we hope next spring as well. And our first and very distinguished guest is Deborah Mckenzie, a journalist and author. And someone whom I have known and been in the orbit of for many, many years. When we were chatting the other day, we figured out that possibly the last time we saw each other face to face was at a pandemic flu conference in 2007.
So, that was the first time we met face to face. I think the last time was at that meeting in Doha.
Oh, okay. So the World Conference of Science Journalists in Doha in 2015, something like that.
Was it 2015?
So let me tell you, all of you, about Deb. She's Canadian, you may be able to tell by her accent, and she was originally a scientist. She did grad research in toxicology and electrophysiology in Canada and in the US, and then she became a journalist. She moved to Europe. She has been reporting for the magazine New Scientist since 1984, and in that role has covered every emerging infection and major pandemic, of which there have been several of the past 30 years. And as we all know, we are in a pandemic now, the worst for more than 100 years. And Deborah was inspired because of the advent of that pandemic to write the first book about it, which was published just a little while ago. It's called COVID-19, The Pandemic That Never Should Have Happened and How to Stop the Next One, published by Hachette. And I'm very, very glad that she's taking the time so late in the evening for her to talk to us about this. So Deb, that's my introduction. Thank you for joining us today.
My pleasure entirely.
So the first thing I just gave the super brief bio of you, but I would love it if you would tell people a little bit more about how you stumbled into this or directed yourself into how you ended up in this specialty and how you came to be the person in the European media writing about emerging infections.
Well, I don't know if I'm the person in European media.
Oh, I think you are.
I'm sure there are lots of other people in other language communities, although frankly, I haven't had time to follow what's been going on there, so I couldn't really tell you. But no, the thing is that when I started in journalism, working for New Scientist back in the 80s, I was mostly interested in environment, as everyone was then. I was covering the ozone layer mostly and starting to get into climate. But then a lot of other people wanted to do that, and it got a little crowded. And in the end, because I had a biomedical background, I just found myself running into stories that people weren't covering in infectious disease in particular. And the increasing fears about biological weapons, which were starting to sort of concentrate some minds in the 1990s. So I kind of drifted over, and eventually I just fell in love with disease. Diseases are great. They're just fascinating. And there was a lot of stories to be told. It just seemed like there was some good journalism to be done.
And I find when I talk to younger journalists that I have to sort of recount the sort of the what seems like an endless series of stories that on emerging infections that we have been involved in over the past couple of decades, since I myself was 5 years old, about, from H5N1 flu first emerging in Hong Kong in 1997 to Four Corners hantavirus in, I guess, was that the early 90s or the early 2000s, to renewed concerns about pandemic flu, H7 flu, Ebola again, and here we are now in a pandemic from a virus, SARS, of course, in 2003, MERS in 2012, and now a pandemic that was from an organism that maybe people were not sufficiently prepared for, but we'll talk about that in a minute.
Yes.
So this is a fantastic book, COVID-19,
Thank you.
Pandemic that never should have happened and how to stop the next one. And it also was a book that you produced incredibly quickly. The first thing I want to ask, maybe I should ask you first, did it really take 8 weeks? Like, was it 24 hours a day for 8 weeks?
Not 24, more like 18. Basically what happened was I was covering this for New Scientist. I mean, I was producing a fat news story every 3 days for about 6 weeks since the beginning. And it just felt like, well, it didn't feel like every other one of these things I've covered, because this is easily the worst epidemic event I've been involved in as a journalist. So obviously it was a lot more screamingly serious, but, well, not really, actually. I mean, I think I will take issue with you saying that this is the worst pandemic in 100 years. There was AIDS. There was HIV.
That's fair. Yes.
Before we got those drugs deployed, that was, and it's still out there, and people aren't getting the drugs, and people are still dying, and it's just slower, but it's going on. And as you know better than most people on the planet, there's antibiotic resistance. That's akin to
700,000 deaths a year, right? No, you're right to correct me. Maybe I should say the worst respiratory.
I'm not correcting you. I'm just like speaking up for some of the contenders here. But the thing is, I was writing all these stories, and I just sort of thought, oh gosh, I wrote stories. I covered SARS, I covered MERS. I've covered all the bird flus as they've come along. I had my newsroom, because I work outside the office from Europe, and they're in London. Apparently I had them running around in a panic the day I called in and said, this flu, this swine flu in Mexico, look, for the record, this is what the beginning of a pandemic would look like. And for years I had been writing about flu pandemics. Oh my God, they could be awful. And apparently some people really panicked. I had to calm some people down. No, really, I didn't say they would always be awful. A lot of people thought that. But then I thought, more of the same. And my agent called me up and said, what are you doing? I said, I'm covering the pandemic. What do you think I'm doing? And he said, gosh, you know about that stuff, don't you? I went, yeah. And he went, you could write a crash book. And I said, what's a crash book? And the rest is history. I mean, he got me a book deal and I started writing. And the thing is, like, everybody said, how could you write a story about something while it's still happening? Well, what I was writing about was the fact that you and me and lots of other people had been warning about this. I mean, the scientists had been warning about this for 20 or 30 years. And, and it's happening and nobody seems to have listened. And, I knew all that stuff. And I thought, this is a time when people will hear it. I can repeat all those warnings. I can get them up to date. I can talk about how they apply to this event. And I can do that in the time that I've got, really. It's not like researching a book from scratch. I can take stuff I already know and then apply it to what I've been covering for the last 6 weeks, and it should come together. What I didn't realize was how much new reporting I was going to have to do. But we did it. I started at 7 in the morning and went to midnight. Then did that again the next day for 6 weeks actually, and then 2 weeks of editing.
Oof. So as a book author, I am incredibly impressed, because that is a hell of a schedule. But I'm also really impressed at the strategy behind this, whether or not you thought this was strategic to start with, because I had a conversation with my agent the other day, and the count of coronavirus books that have been sold to this point, depending on how many deals have been actually disclosed, is somewhere between 50 and 100. So here you are out in front of the pack, and both in terms of sort of a business strategy for a writer, but also in terms of stating the case for where we actually are in this pandemic. It's both smart, but it also was incredibly useful. And as I read your book, it brought back to me so many of these warnings that you and I have heard over and over the years. And it just sort of twisted my heart that so many of these things we could have listened earlier, and yet we didn't.
Well, that heart twist is really why I did this. I mean, I was feeling much the same way. You're one of the few people on the planet who's pretty much in the same position. And you know how many of these warnings have gone out. And I thought, okay, people could finally hear it now. People are now going to listen. My problem is that people are sort of saying, oh, how could you possibly write a book about it already? You can't possibly know that much. One review actually said, I'm sure it will be congealed. Congealed. Ooh, I didn't know facts did that. In a few weeks. Well, look, a lot of these facts have been around for 20 years and they haven't congealed yet. What people don't understand is that I'm not writing the same stuff you're reading in the newspaper, which, is amazing. Exposés are being written every day by some of the brilliant people who are covering this, but I'm not doing that. I'm taking 5 steps back and saying, what happened? What's the big picture? What do we need to go do? Where do we need to go from here? And along the way, talking about some really scary viruses, and, guys, hello, are you listening? I think people are now. I hope so.
I think so too. So I want to remind everyone who's listening to us way up in the double digits now. Thank you, everyone, for coming. There is a Q&A box, and if you have questions for Deb or for me, but I expect you are here for Deb, please type them into the Q&A box. We are going to speak together for about half an hour and you get to eavesdrop, and then I'm going to relay your questions to her, and we'll do that for about half an hour as well. You don't all have to wait until she and I are finished talking. The Q&A doesn't magically open up at 5:01. You can put them in there at any time. So one of the things that I was really struck by in the book is the extremely conversational tone that you take. Speaking to the reader, not as a scientific authority, though you have enormous gravitas from your experience, but as sort of like as a friend who wants to take them along this road, down this history of our disrespect of emerging infections and where it has brought us to now. Do you, out of all the observations you make for that reader that you're trying to be a friendly guide to, out of all the warnings you review, is there any one particular observation that stands out to you more than any other?
Yeah, we need to fix the disconnect between the experts who know what's going on and the parts of our complex global system that can respond to warnings. There's nobody whose job it is to do that. I talked to as many scientists as I could. It was actually a bit scary. Usually I for any fact I put in an article, I talked to 2 scientists. And this time I would email 5 of them and 4 of them would come back and say, sorry, Deb, too busy working on the pandemic, can't talk to journalists. Working with
well, at least they acknowledged your email, which is getting harder, actually.
No, 2 of them wouldn't. 3 of them would get back. And the one of them would go, don't have time to talk to journalist Deb, but I'll make an exception for you. Keep it short. So thank heaven for some of those people. But the ones who would talk about this, and some people are pretty angry and they were happy to talk about it. Basically, their job is not to decide how policy should work. They're scientists. Scientists should not decide policy. Scientists should have some way of talking meaningfully to policymakers who do, then do something. There's nobody whose job it is to sift through all the various things that are coming to us from the world of science, from the world of health monitoring, from the world of public health, and then say, where are we? Where should we be? How can we close that gap? It's no one's job. There are lots of government departments that deal with public health, that deal with all sorts of, research funding and even, some surveillance of disease in various parts of the world, but nobody brings it all together. It's no one's job to make it happen. The WHO is a bully pulpit. They actually have done very well over the years at waving their arms and saying, guys, we got to do something, but they don't have the money. And all they can do is pull people into a room, and the people they pull into the room are health ministers, and they don't have much power. In a government, it's the finance ministers and people like that who have the power. So, typically, they can try and get stuff, but it's just nobody's job to respond to all these things. The point of going through all the warnings we had that we ignored is to look at Why do we ignore it? Why did we ignore them? What structures do we need to put in place? I think I've got to come back to the word structures. Some kind of structures, and not just one, has to be put in place to close that gap. You know, you've got to look. Well, apparently, a couple of days ago on the 17th, the finance and health ministers of the G20 group of nations, the 20 largest economies in the world, had a Zoom meeting, much like this. And basically, we're talking about a report they asked back in March for the WHO to make, to say, where are our shortcomings in pandemic preparedness and what do we need to do? I think it's telling that I haven't been able to get my hands on a copy of that report. Where's the secrecy? What is that serving? The only people, as far as I can tell, who even posted the final statement of the meeting were the British. Bless them, they've done something right. Basically, the finance minister in Britain posted the final statement. The G20 secretariat doesn't even seem to have done it. It flew below the radar. I don't think. Apparently now come up with a bunch of recommendations that they're going to kick forward to the summit in I think it's going to be November 21st of the heads of government of the G20. And are we hearing anything about this? You know, have they proposed a sort of a constant structure that the G20 will set up, some kind of a network of their health experts that will do surveillance and pour a lot of money into surveillance of diseases that are coming out in parts of the world that we know are hotspots of emerging disease? Are they planning a particular budget to be put into, you know, for example, that R&D roadmap that the WHO came up with about 4 years ago for the most worrying viruses, one of which I have to say was coronaviruses like this, that we should be putting money into drugs and vaccines and diagnostic tests for. You know, is there going to be anything like that come out of the final statement? I talked to a couple of friends of mine who are experts on how the G20 does things, and they said they'll probably just take note of the statement. So here's
that will move us forward.
Oh yeah, well that's just it. That's what I'm afraid is going to happen now. You know, no one's going to want to know. We're dealing with a lot of the final statement of this meeting on the 17th was, you know, we're you know, all going to get together and we're going to do things right. And we're going to, you know, get ahead of COVID-19. And that's the sort of stuff they do have to say. They did say a few things and afterwards, we got to stop this happening again. Okay. They at least did get that in there. They said blessed little about it in terms of detail. And I'd like to know how much is going to come out of that summit. You know, it's kind of not a good sign.
So before we talk about, we'll talk more about where the world goes from here. But before that, I'd like to back up a little bit in history, because I think some people, certainly some among the people listening to this webinar, are some of my students who may not have been born when SARS happened, or at least when H5N1 first emerged. And for many of the people listening, the concept that emerging infections are a persistent, repeated threat, and that this is not a one-off, though this is the one that really sparked, may be new to them. So can you walk us through what some of the, let's go back to, well, go as far back as you like, you know, go back to H5N1 or go back to SARS in 2003 and sort of talk about what are the points where we saw that, where we understood our risk and did or didn't do something about it.
Well, we've always known pretty much ever since we've understood the biology of flu that was going to be a risk. I think because the last two flu pandemics in the 1990s, they were in the 50s and 60s respectively, weren't much to write home about. There wasn't much of a modification to the flu virus, made it a little bit more dangerous. There were 1 million more people killed, I think, in the Asian flu in 1957. Less than that in the Hong Kong flu in 1968. That wasn't really worrying people until we discovered bird flu could jump to humans, whereupon it had a 60% death rate. Right. And that concentrated a few minds. Everybody was pretty scared by that. It was about when I was starting to write a lot about disease, and I saw that and I went, oh my heavens, yeah, that's not something we were expecting. Then there was SARS. No one was expecting that. I mean, we vaguely knew what coronaviruses were. They're the only RNA viruses that can correct the mistakes they make when they change their genes around, when they replicate. Everybody, all the other RNA viruses can't fix their genetic errors when they replicate. Coronaviruses can. They've got this weird, strange mechanism no other viruses got. And there was a handful of virologists working on coronas just because they were really interested in that. And then suddenly one of them starts killing people. No one was ready for that. Totally out of left field. So, okay, then there was that. And well, then there was Hendra virus in Australia. No one was expecting that one either. And then they found one in Malaysia, Nipah, very like it. And everybody thought, oh, this must be a, it started killing pigs, and then the people who took care of the pigs died. And they thought, oh, this must be a pig disease. It took a while, and some Australians and people from the region, from Southeast Asia, who'd worked in Australia, who sort of went, hang on, are bats involved with this? And they put it together in record time, actually. Worked out Hendra and Nipah were a totally new thing, a family of viruses nobody had known before. Ebola, we figured, well, of course, that was discovered in 1976. That was when people started thinking, wow, new viruses, this is not good. And then HIV came along, and they realized, okay, we can get new viruses from animals, this is not good. But everybody figured they had Ebola pretty much put in a box. It happened in little villages in the jungle. You go in, you contain it, it only kills a few people. Yeah, and then it got into West Africa in 2014 and killed 11,000 before it was gone. And was adapting to people as it circulated, which was even scarier. I mean, you get all of these things happening, and then, all sorts of other things happening in the margin that don't hit the headlines, like the pathogen that's killed off so many of the world's amphibians. That's still out there. Doesn't get enough coverage, but it's still out there killing, frogs and salamanders. The virus that's related to SARS, and then the virus that was very much like SARS, MERS. I hadn't even heard of this one until I wrote the book. I mean, I was thinking, has there been anything else like this? And then I found out about SADS, which only kills pigs, but definitely comes from bats and is pretty much the same kind of virus. I mean, there's just so much of this out there. There really is. You may or may not have seen it in the news. When I was writing for New Scientist, I mean, New Scientist makes it their business to look at science and society. They really deal with that juncture. But a lot of people, other people don't. I was surprised writing this book. I had an excellent editor at Hachette named Sam Raim, and I was talking about SARS in the book, and he said, you're going to have to give us a few more details, Deb. I don't think very many people in the States even remember what SARS was. And I went, really? Okay, I talked to too many scientists, and I'm Canadian. Canadians don't forget that. It killed a few hundred people in Toronto.
Right. So that is one of the things that I think is interesting about this long history of these perennial emergencies that arise, that terrify us, and then that we let go, is that they hit different countries so differently. As you say, it happened that in SARS, among those 12 people who were first infected in Hong Kong from a traveler crossing their path from Guangdong, some of them went to Canada before the international alarm was sounded. Out of really just sheer good fortune, the United States knew it was coming before there was the threat of people crossing the border. So Canada was utterly shocked. What seemed like most of Toronto put under quarantine. God bless the Canadians. They actually went. Thank you very much for your national character. But to me, go ahead. Yeah, no, go ahead.
That's okay. I was just thinking, it was one elderly woman in the Metropole Hotel that took it to Canada. And we were also very lucky with SARS because it didn't spread before you had pretty bad symptoms. So it was mostly health workers. If a health worker got a fever, they stayed home. And I have to say, Toronto almost let it get away. They let up on the restrictions for a while, and they started getting cases going up again. We've all seen that happen lately. And that happened with SARS in Toronto, and they slammed the controls back on and got it back under control. And that's one of the things, you see, because it only spread after symptoms started, we were able to do what we all know now is containment, quarantine, contact tracing, the whole thing, where if you've got symptoms, go home for 2 weeks. And we could actually abolish it that way. It never got out of control in any countries where you couldn't have controlled it like that. Some countries are more, yes, I'll do what I'm told, sort of Canada kind of countries. We're not always like that. Hockey games tend to get us a bit riled up. But basically, I had senior people at the WHO telling me, this gets loose in a big mega city, Mexico City, Manila, Bombay, who knows, anywhere, hell, New York, I don't know. Then yeah, it's going to be everywhere. It's going to get into the community. We're not going to be able to stop it with containment, and we're just going to have to live with this virus. Let me remind you that SARS had a 10% death rate.
Right, 8,000 and some people around the world in what, 24 countries, and
Mhm.
774 people died, I think. And yet,
It
that was
was,
a 4-month span, and that's
yeah,
because that was almost 20 years ago. It's vanished from so many people's memory, except for
yeah,
infectious
just,
disease reporters and
yeah,
scientists.
yeah.
So, so I'm just precisely because of your incredibly deep background in this. You wrote this book at the start of everything. Many months have passed since you've hit send on the manuscript, and I'm just trying to imagine. So I'm going to make an assumption here that you must have experienced the sense of horror watching the ensuing months unfold. Can you talk a little bit
Oh,
about how that has felt?
well, who was expecting that? The States and Britain are the two countries that have talked the most about pandemic prep.
Right.
The States especially, but Britain as well. I've been to meetings on pandemic prep in both those countries. It was a place where people took it seriously. I have to say, I think probably of all the EU countries, there was more attention paid to that in Britain than anywhere else. Possibly, I don't know, maybe because it's in the same orbit as many people in the States. The States really led the crowd on this. So the people in the world that everybody figured would have this knocked were the States and Britain, and boy, it didn't turn out to be that way, did it? They're going to be dissecting this one for years, but I have to say, I've been in France. I was locked down. I was writing. I didn't really notice. I noticed because, yeah, only my husband could go to the grocery store, which was a little scary. I had to explain to him what certain foodstuffs look like so that he could, buy them. It's not his job. He does other things. Normally not that. We didn't die. We more or less ate. But basically, apart from that, France really locked down. They meant it. They really got their case numbers very low. And then they opened up again. And in June, we were going to restaurants and people were wearing masks and everything was okay. Well, now, of course, case numbers are creeping up again. But they did the right thing early on, and they really got it under control. Proving that it's possible. I mean, this is the country where people wearing yellow high-vis vests were shutting down entire cities for demonstrations last year. But when it came down to it, France actually did rather a better job of locking down than neighboring Switzerland. I mean, it's a matter of some concern to us because, I've got the bus to central Geneva running past my door every half hour. We're that close to the border. And they didn't lock down as hard and they didn't get their case numbers as low. And Geneva in particular has now got, a lot of cases rebounding. So, even places that really did it strictly haven't got it under control yet. But what's happened in the States? I mean, Britain, I think, still doesn't have its testing regime together, but what's happened in the States has taken everyone by surprise, I think.
It has been
Nobody.
shocking. And to remind, we're speaking under the auspices of Emory University, which is literally next door to the CDC. CDC people are faculty at Emory. I wouldn't be surprised if some CDC people have dialed into this. And I have to say, as a historian of the CDC, which is what my first book is about, people have asked me from time to time what I would, what pandemic planning looked like, what would happen, and what we could expect. And the one thing I could never have predicted was that the CDC, in the largest health crisis on the globe, would be forced to be absent, and the senior American political establishment would be either absent or actively hostile.
Yeah.
It has been just staggering to live through.
Yeah.
But that raises a question that I want to ask you, though, because you have this amazing sort of doubled or tripled lens into what's been going on, because you write about England, you're from North America, you're paying attention to pandemic response around the globe, and you live in a part of the world that did it right, at least for a while. So what do you think? How do we come out of this? If there's not equal political will across the globe, and if there's not equal the will of the people to contribute, where are we?
Well, I don't think it's the people that have let us down in this case. I mean, people now say that hierarchy is dead. We're far too complex. It's all a network. I think what's happened in the States and to an extent in Britain is the central leadership. and certainly coordination. I mean, look at Canada. It's a similar political structure to the United States. The provinces are, in many respects, more independent from each other than countries in the EU are. Although countries in the EU are sovereign when it comes to health policy. In fact, the 4 constituent nations of the United Kingdom are separate when it comes to that. But provinces in Canada are as independent for health as states in the US are, but they got together and they coordinated. And, you know, some did better than others. Certainly a couple of provinces did pretty badly on elderly care homes. But they all pretty much did the same thing at the same time. And that kind of coordination, there was just a research paper came out this week, actually, looking at the extent to which coordination between adjacent political units is important to getting it right. Because you might keep everybody locked down, but then if people are coming over from the state next door, or if you can go over to the state next door, you know, to go to a bar in the evening, although the bars are shut and yours, I mean, it's just not going to work. So obviously you do need that central leadership. You do need that coordination. Maybe there are ways of achieving that that are different, but the power structures we have just failed in this case. It's interesting that in China, you know, they kind of had the worst and then the best of all possible worlds. Their local authorities, in an authoritarian system, local authorities really don't like sticking their head above the parapet. They don't like going to Beijing and saying, you know how half our pigs died last year? Okay, we've got this mystery disease in Wuhan and we need to shut the city down. Okay, you can almost understand why they didn't want to do that. China's been through some rough luck lately. I'm not saying it excuses it, but okay, the local people tried to keep it quiet. That's what happened. And in the end, Beijing finally realized how bad things were and came down like a ton of bricks and shut the whole place down. When that happened, they did amazing things. No city but Wuhan and the few cities around Wuhan had to lock down the way the village I live in France had to lock down. Beijing never had to do that. They could do it with containment, with quarantine and contact tracing, and then some social distancing. They shut down their public transport. They shut down transport between cities. They shut down big gatherings. They did a bit of that. They weren't totally locked down. They didn't have to do that in most of China. And that's where the infection not only started, but went largely unacknowledged for about a month. So, you know, it's amazing what you can do when you actually have, I hate to say it, but a central structure that can really say, okay, we're all going to do this. Right. But at the same time, what we have to keep in mind as well was there was also a lot of local autonomy in the different cities in China. They could look at their local structure and say, okay, we need to do this. We need to do this. Okay, it's not working. We need to do this as well. It was very flexible. So, you know, we're actually learning from this pandemic the kinds of governing structures that don't work and the kind of governing structures that do. And different countries have had different mixtures of the two. I don't know where we go with that knowledge now in order to turn it into structures that will work everywhere. But I do know we need to do it on a global basis. We need to be doing it all together.
So let's pick up from that. I'm going to do the thing that we journalists do to scientists and that scientists hate, which is to ask you to make the big sweeping statement, right? To sort of ascend to 30,000 feet and tell us sort of, you know, from your experience of reporting on this, what happens next? Where do we go from here?
Well, I hope there's going to be, you know, one serious global kind of conclave of some sort, not the next World Health Assembly, you know, something a little bit more extraordinary than that. Saying, right, we need to do something. We got to do it. Something a bit better than sweeping it under the carpet at the G20, I think. The G20 could take the leadership on this. Anybody's listening. Really, they could. Because the WHO, I'm sure, has done a bang-up report on what we need. Because they would only have had to pay attention to the report that was issued, was it last week? Gro Harlem Brundtland, the woman who was the head of the WHO during SARS in 2003. Basically came out with a report last year, absolutely itemizing the way in which we were not prepared for a pandemic. They came out with a follow-up report to that last week, basically saying, yep, told you, no, this is what we need to do now. You know, a lot of the groundwork has been laid. And what we need to do now is do something about it. We need to put structures in place. From 30,000 feet, I want to be able to look down and see in every country somebody whose job it is to report to a central authority saying, we are doing the following surveillance for new infections. not necessarily going out and isolating every virus in the world. That sounds like a bit of a wasted effort to me. But certainly seeing what viruses are in people and could get out of control on a pretty regular basis. And if you can't do that, waving your hands and saying, I could use some help here, you know, and getting it.
So
and then,
surveillance and political coordination and some kind of agreement, if something like this happens again, if we need to do a lockdown, is there someone in the structure or people in the structure that tells the world, okay, it's time?
yeah, actually, that's something on which it's going to take some political footwork. I mean, I've thought more in terms of what we need to do to spot the next one fast, because that's obviously what failed this time. What I'd like to see is well, one of my other things that I cover, I don't just cover disease, I also cover arms control. They actually call me the doomsday correspondent in certain sections of the newsroom.
Congratulations.
The letters editor tends to call me Ms. Apocalypse. Thank you.
Oh, I used to be Scary Disease Girl. Come and sit by me.
Oh, right. Okay. And nobody will come near us. That will be great. We can buy each other.
Be very safe.
Well, anyway, what works with arms control is inspection. I mean, people say, there was an excellent essay a little while ago written by Dave Heyman, the guy who ran the campaign against SARS when he was at the WHO, and he was writing for another sort of non-governmental about a year or two ago. And he said the trouble with international law, like the international health regulations, which govern epidemic control on a global level, that's the treaty we all belong to, no one's heard of. Basically, you can't enforce it. It's international law. There's no enforcement structure because nobody's bigger than a sovereign nation state. And international law, by definition, is between sovereign nation states. So who's going to enforce it if one of them decides, no, I don't like that treaty I signed on Brexit a month ago. Sorry, shouldn't have brought that up. But yeah, okay, there is no enforcing international law. Yeah, but they've solved that problem for arms control. You don't enforce it, you verify it. You send in inspectors. You say you don't have any chemical weapons? Great. Mind if we visit next week? In fact, it doesn't matter if you do mind because you just signed a treaty saying we get to do that. And they do. I mean, people talk about, you know, sovereign rights of nation states. There's apparently a sovereign right of nation states to refuse inspectors from the WHO saying we'd like to see this virus you tell me broke out in Wuhan last month. They don't have the right to go in there. Hell, if somebody said, hey, there's a chemical weapon in Wuhan under the Chemical Weapons Treaty, they'd have the right to go in there and look at it. They have the right to go in and look at their civil nuclear program and make sure they're not diverting isotope. They have that right to look for it everywhere because all the countries in the world belong to that treaty. And they let the International Atomic Energy Agency inspectors in. Why don't we have that for disease? You know, and it would be great because we're all on the same side. We're not trying to catch somebody making an illicit weapon. We're trying to help somebody not get killed by a surprise virus. Surely that is going to be easier than verifying arms treaties. And if we go in and we say, you say you have no strange diseases this year? Nope. So how many tests have you done? How many things have you looked at? Not many. So you don't know, actually, do you? Yeah, I guess not. Okay, well, we'll help you fix that. You know, it can be carrot and stick. It can be, if you've got a new disease, we're coming in and looking at it. If you say you don't have any new diseases, we're going to make sure you did enough looking so that you know. They already do that as part of the polio eradication drive. If you say you didn't have any polio last year, I mean, all the countries in Africa can do this. You go in and you say, okay, how many cases of limb paralysis, flaccid paralysis, did you look at in children? In the last 12 months. There's a certain number you should have had that weren't polio. And if you didn't look at that number, you're not looking hard enough because you're missing cases and some of them might have been polio. Everybody can do that. Why can't we do, you know, and if you're not looking at enough, we will help you build your surveillance system up so you can. And they've done that everywhere in the world with the polio eradication effort. Why don't they do that for new viruses? For unexplained diseases, for, you know, why don't we just go into places where we know people are encountering bats on a regular basis? And maybe we should sort of stop people encountering bats on a regular basis. That's another thing. But, you know, there's precedent for this in arms control, inspectors, verification, trust but verify. I think we could do that with disease.
This is a fascinating concept to me, and it's so aligned with what we need to do, and it's also sort of metaphorically aligned as well. That what we do with arms control is to prevent the world or portions of it from dying from aggression
Yeah.
by another state, and surely we could do that for diseases as well, which equally threaten the world. So at this point, I'm going to let the audience in because we actually have questions stacking up and lots of people want to talk to you. So the way this works is that I have to read the questions to you. So let me take a look, and because there's lots here. These are going to be really exciting. So let's go back into history first. Do you think is there a parallel between how we, especially here in the United States, have responded to COVID-19 and how the US or the world responded to the 1918 flu?
1918 was unique in many respects. I mean, it was happening sort of at the culmination of the First World War, and governments were hushing things up. That's why it was called the Spanish flu. They weren't at war, so they could actually put it in their newspapers. Nobody else did. Basically because they thought it would be bad for morale. But that actually it led to a wonderful natural experiment in the States. Some cities lockdowns, but was it St. Louis and Philadelphia?
Philadelphia, yeah, with the two curves.
Yes, exactly. And that's where we learned how to do social distancing, folks. Really, I mean, it was just an amazing natural experiment. But it was also not terribly coordinated from the center, was it? That's interesting, actually. I hadn't thought of that. The thing is, though, that we did respond to that in places with the only thing we had, but a lot of people died, and the thing with flu is that there's no question with the flu, not something that is fairly well adapted to people, which that flu was. There's no question of quarantine and contact tracing and containment. You just don't. Which is one of the reasons why nobody's pandemic plans really had much in the way of detailed instructions for quarantine and contact tracing, because you don't do it with flu. You just do, social distancing, because it spreads so fast that containment is a non-starter. And in fact, I think that's one of the reasons the WHO was slow to call it a pandemic. That would mean a lot of countries' pandemic plans would kick in, and they're all built around flu, because that was the one pandemic we knew was coming, because that's just what flu does. And we understand that. So the interesting, 1918 taught us a lot. There are parallels. I mean, all we had was distancing then, just as that's all we've got now, pretty much, although we could have done more containment. But at the same time, in 1918 in the States, it wasn't very centrally coordinated. And that's, of course, what's happening here with this pandemic in the States as well. So yeah, there's parallels there. Some towns have been out of luck, and some towns have done all right, I guess.
And the thing for me that, one of the lessons of the 1918 flu, I mean, we have to remember, there was no vaccine in 1918. The flu virus wasn't even identified until 1933. So 1918 is what herd immunity looks like. 675,000 people dead in the United States, millions dead around the world.
Totally.
At a certain point, the virus adapts to you and you become immune to it, but that's what the damage is first. That is one of the lessons I think we need to take away. So, oh my God, so many questions. Okay, so we've talked about, someone has asked about other diseases that could become pandemics. I think we talked about that. What do you think about we're going to jump around a bunch. So we were talking a moment ago about the role of the WHO and whether new, international agreements, multinational organizations could be established. Has the WHO really been crucial? And here's the part two of the question. The United States government says it wants to withdraw from the WHO. What does that mean for the future of public health in the world?
It means that you've got a government that's trying to deflect attention from its own failures to handle the pandemic. And it started out with an ideology that rejected multilateralism. So are we surprised? Not very. I think if you guys have the same government in November, the rest of the world is just going to have to get on with this, and not wait for United States participation or leadership, which is really a shame, because you've got a lot of the good virologists, and certainly the track record, and then the United States has been the leader in global public health for years. It would be a shame if that happened.
To see it voluntarily walk away from that chair is really heartbreaking. So someone
Well,
wants, go ahead. I'm sorry, I cut you
sorry,
off.
no, it's okay. It's just it can be argued that if it's going to be global, we can't be looking for leaders really. I mean, within a country, maybe, yeah, obviously centralized leadership and certainly centralized coordination. With maybe local people having a bit of leeway to adjust things to their local circumstances. That worked in China, which has a tremendously centralized government. You know, so obviously a little bit of mixtures of local autonomy and central coordination is what you need. On a global level, I'm not sure leaders are what we should be looking for. I think what we should be looking for are networks, flexible networks of people who will coordinate with each other to watch for the next outbreak, to develop countermeasures for the various viruses that we know could be a threat, and then to coordinate some kind of international response. The one thing I haven't thought much about is how do we coordinate the international response the next time? Mm-hmm. I've thought about watching for it. I've thought about developing countermeasures because those are the things people are talking about. The thought of having an international coordination mechanism for how you respond if it gets out of control like this again, that is what the WHO tried to do. Actually, it was sitting there saying, no, you've got to try containment, really. You don't give up. Don't just go straight to, you know, social distancing. You can contain this. You just track and trace. Look, the Chinese are doing it. You know, and they were right. I don't know how many countries paid much attention. But, you know, we need something that can work much more effectively, but along those same lines.
So a couple of other people have asked about sort of the political dimensions of this. So I'm going to toss two questions at you at once and let you decide which to answer. One is, was there any country that you feel did this perfectly or a country that did it best? And here's part two, or this related question. The countries that you have named that responded with alacrity to COVID have a lot of different political structures, right? All countries agree. France is not China, and so, you know, New Zealand is not Greece. So is the difference not so much? It's not the political structure as it is political competence. Is that something you can build for?
It could be. I mean, you know, this was an unprecedented situation for most modern governments. If you had good people. I mean, the health minister in South Korea seems to be a phenomenal sort of person. I think that they were just lucky to have that person. But then also people have said, well, having a history of SARS didn't hurt because Canada did okay and South Korea did okay. And Vietnam, with a very centralized government, did very well, very well. It's not getting much attention, but it's brilliantly. Taiwan, again, very authoritarian government, but not as much as Vietnam, but also a history of SARS. But hey, New Zealand didn't, you know, and they don't have an authoritarian government. I don't know. I think maybe it has something to do with the social contract that when the government gets together and talks to the country and levels with them and says, look, we all got to do this. It's for whatever reason, on whatever organizational basis, the kind of place where people go, yeah, okay, great. I don't want to die. I will do what you're saying. You know, maybe that's the commonality. I hope that there will be armies of sociologists working on this because it would be nice to know it works.
So let's talk about, because we're talking still about response. One of the listeners would like to know about contact tracing. Are there places where it's worked? You know, it seems in the US we've just kind of given up on it, possibly because we have so many cases that you cannot successfully trace. But do you think of that as a useful strategy?
South Korea. The thing is that in South Korea, apparently days after they found out, the 20th of January was when China stood up and said, oh, okay, it does spread person to person, actually. I think 4 days after that, South Korea, people high up in the the health ministry, called their companies together that make tests, make PCR tests and diagnostic equipment, and said, okay, you guys design something for this virus, go all out, we'll buy it from you. You don't have to worry about making a profit. And as far as testing it, we will be testing your results, and you know, you can go right in there and start using it. And we'll use your first efforts to test people as your run-in, your trials to establish the efficacy of the test. In the States, the CDC insisted that there had to be efficacy trials of any test before it was actually being used. in a real situation. Korea said, no, go right into it. And then, you know, if a doctor told you to get a test, it was free. You could go and pay a nominal amount if you were worried and the doctor hadn't told you to go. Anyway, you found out. And then there were apps, maybe they were a little intrusive. People have discussed that. That can be adjusted. The point being that, you know, you found out if you were likely to have run into the virus, and then you could go get tested and find out if you were infected, and then you did the right thing. And there wasn't anything, well, if you stay home for 2 weeks, you're going to lose your job. You know,
So because we're talking about testing, I want to skitter over to, or slide over, move just a little bit over to some of the other, you know, scientific efforts, which is what you think about the vaccine push at this point. And someone has asked, you know, there are reports that vaccines could be ready anywhere from 18 to 24 months. President Trump seems to think it's much faster than that. How do we make sure vaccine distribution is equitable under the kind of structures you're talking about? How do we make sure it's not just sold to the highest bidder? Certainly in 2009 in H1N1, we had some real uprisings of nationalism around the vaccine that were very troubling. Have you thought about this?
Well, WHO have this COVAX thing, and not just the WHO, but Gavi. I got a lot of time for them. They are a very lean, mean, effective organization. The global organization based here in Geneva that helps poor countries buy routine vaccines. They make sure that they can get a deal on measles vaccine that will, you know, that kind of run-of-the-mill bread and butter stuff. They do that. And now they are organizing this COVAX thing with the WHO and a number of other agencies. So they're bringing, I think they've got 136 countries now that are all sort of, okay, we're all going to share whatever comes out. We are going to give it to our, I think we're going to have some sort of a, I think each country maybe has got a plan for who's going to get it first. It's mostly health workers and people at risk and, you know, things like that. But it's going to be some approved plan. Everybody's you know, got this worked out, what they're going to do with vaccine when it becomes available. What really worries me is that there is a great deal of pressure from Washington at the moment to get something approved before the 6th of December. Is it the 6th or the 3rd?
3rd of November. Yeah.
Of November. Yeah. I'm trying not to think about it. Basically, if that happens, I think one of the companies was saying, well, gosh, you know, we could have something kind of in manufacturing maybe by the end of October. No, I'm sorry, they won't have it through a proper safety test by then. And all the companies have said, no, we're not going to rush this for political reasons. But if somebody says, oh, look, you know, we've got a vaccine, I've got the vaccine first. Russia's already been trying to do that, you know, so is China. That's just going to screw things up. Nobody's going to trust the vaccine, even if when it eventually does get tested and come out, it you know, may be perfectly all right. It's people are going to just play it for political advantage. That's the worst thing we could possibly do. I mean, you don't need me to tell you that. But that worries the hell out of me. We've got enough trouble with people mistrusting vaccines as it is.
That is very troubling to me, that this could turn people who are supporters of vaccination, as everyone should be, into people who are skeptical of vaccination because of manipulation around the coming vaccine. It's a really profound communication challenge. And that's what a couple of people want to ask about communication challenges, and we're coming up on the hour, and so although we won't wink out of existence at 5:30, we can go over, but I think an hour is a good time to hold people to, especially you, because it's so late for you. So several people have asked in different phrasing, what can we learn about, what can we learn from this experience about really getting people to pay attention to I guess, science communication, to listening to the scientists, to getting scientific concepts out there clearly. And here's part 2 of the question. Can we take those, if there are lessons that we can extract, can we take those lessons and apply them to the other big science questions in the world right now, to climate change, to antibiotic resistance, to global food security? But let's talk about the sort of what we've learned, for good or bad, about communicating science at this moment of emergency.
Well, I think in many countries it's been done very well. I mean, one heartening thing about this whole thing is that people have started realizing that it really does help to have people who know the facts. if you're trying to control real, honest to goodness virus. It's out there. You know, knowing how it behaves is kind of useful. And doing what the scientists know you need to do to save yourself from catching it and dying is, you know, it concentrates minds wonderfully. I think people are taking that kind of advice more seriously than they were. But then there's also a lot of pressure to politicize it. And we were just talking about some instances of this, you know, at least pretending you've got a vaccine out in time for a certain election. Basically, you know, that's not going to, yeah, that's not science. That's messing with science. That's politicizing the science, and that's going to create, you know, conspiracy theory. People who are receptive to that. It's going to help promote people just not wanting to know about these strange elite people that know about science. I mean, on one hand, we've been in Britain. Interestingly, we've been seeing the chief scientist and the chief medical officer in front of microphones at briefings almost every day. I don't think people would have been able to say who they were before this happened. I don't think I could have. And so science has a face, you know. On the other hand, because of that, and because there is so much political pressure around this, some of those people have been messed around with for political ends in ways that, you know, are damaging the ability of scientists to talk to people and tell them the things they should know. So it's kind of cutting both ways. I don't know what the answer to that is. I think the next big piece of writing I'm going to do is looking precisely at that, because with climate especially, you know, the reason I wrote this book was because I thought people will be able to hear what I've been saying for decades, and more news stories aren't going to cut it, because the last 50 million news stories didn't cut it. I don't know if books do. I thought I'd try something else. What do you do to tell people, no, there's other problems? As you say, there's food security, there's antibiotic resistance, there is, heaven help us, climate, which is massive and way more scary than COVID-19. And in every case, there are people who have gone to an awful lot of trouble and spent their lives working really hard to find out what the facts are. And there are not facts in many cases that people want to know. That's a very difficult circle to square. Now that we've had a pandemic, people have at least discovered that some of the things that scientists were talking about were true. Maybe they will be more inclined to listen to the others. I don't know. And I don't know what promotes that kind of receptiveness. Perhaps there are government structures that just need to step in, whether people will listen or not. I don't know.
So certainly here in the US, there have been some calls for a revival of science education, the kind of science education that people would have had in schools, you know, around the time of, I guess, the push to go to the moon or something like that.
Yeah.
Part of the core curriculum in the way it isn't now. Of course, you can't talk about that without immediately talking about inequities in education and who actually has access to that kind of training and whether it is truly made available to everyone. Every single one of the issues within this is like a Pandora's box, and you open it and all these other things come spilling out.
Well, inequity generally, you know.
So I think I just want to kind of ask you for sort of a big final statement. Again, having heard the things that our audience is interested in, the questions of relationships between nations, of responsibility within a nation, of challenges of communication, of getting the policymakers to listen to the scientists. Is there any sort of like final takeaway that you want to leave us with as people go on to endure however many more months of this we endure?
Well, at least you haven't asked me when's it going to be over. I don't think it will be. One way or another, we're going to be living with this disease or another one, or, you know, what we need are structures. I just keep coming back to structures. We need a constant sort of collaborative presence among nations that is focusing on this problem and has the diplomatic clout to get things done. We know what we need. We need surveillance, we need countermeasures, and we need some sort of way to decide how we're going to coordinate global response the next time. And you know, some sort of book on that. There are people who've spent their whole lives writing treaties about arms, treaties about the environment, treaties about this, that, and the other. The international health regulations have been around for a century, and they are okay as far as they go, but they're not good enough yet. We have a treaty we can work with. We should be working within that to get everyone together in the same room and thinking about this and not stopping thinking about this and having a mandate to actually enact principles that everybody signs off on as a matter of international law, verified international law, the way we sign off on other treaties, the way we signed off on the Bretton Woods agreements that set up the World Bank and the IMF. Every country gives up a little bit of sovereignty in order to have those guys sort of checking out various aspects of their financial controls and stepping in if they need to do that with disease. We need to keep that going. I want to see a structure come out of this that will keep us focused on this and everybody focused on this, all countries. Man, if there was ever anything that really showed us we are all in this together, well, you know, the next thing's going to be sea level rise, but by that time it'll be too late. Let's get it right with disease. And then who knows, maybe we'll be in the habit of all sitting in the same room and doing something other than, you know, kind of waving our arms at the UN and not getting things done. Maybe we could have something that actually works. It would be the way forward.
So from your lips to God's ears, as they say. Deborah Mckenzie, thank you so much for this just incredibly illuminating conversation and for making yourself available to the community of Emory and to the Georgia Center for the Book and to all my students whom I forced to listen. Thank you, students. And to staying up late to be with us. Everyone, to remind you that Deb's book is COVID-19, the pandemic that never should have happened and how to stop the next one. You should all buy it and read it. It's fantastic. It's exactly what we need. It's exactly what we need, a breath of truth-telling and fresh air at this moment. I'm excited to hear there might be a second book in your future. So thank you again so much. I'm going to close the session. It was marvelous of you to join us, and best of luck.
That was lots of fun.
Thank you.